positioned appropriately, the head's turned slightly to the side. I'm going to bring my ultrasound in, and because I'm going for right internal jugular, I'm going to put the ultrasound near the left foot. Some people put it near the right foot, that's fine, but I'm going to make sure that it's in my line of sight. I'm going to use this screen to put it, oopsies, right the way over here. So when I'm here, I'm just going to look straight at the ultrasound screen, okay? I'm just going to turn that on and let it start to talk to the big screen.
Why do you do that? When you put it here?
Oh, look, see, what I like to do, and I think is important for ultrasound success, is to have everything in a line, okay? Because if you think about a pilot landing a plane, right, he's not sitting this way and flying that way, is he? So I want to make sure that from me to the vein to the machine is all in a line, or at least as close as possible, and that way, if it looks straight here, it's likely to be straight there.
Makes sense.
Okay, so I've set up the patient who's on the monitor. We've set up our ultrasound machine in the right area. Usually I do a little look-see first before I get sterile.
Yeah.
So just to see what's where. So I've got my marker on this side, marker on the left-hand side of the screen. Just going to have a little look, unfreeze that view. Okay, so I can see here that my depth probably needs to be maybe one down there, just to make sure I get that carotid clearly in view. And I'll put my focus ever so slightly up. Where's the focus? There's a focal zone at both vessels. That's good. All right. So I've got my vessel in view. All right, and I can tell looking at the way the neck's aligned, I can tell that if I move this way and this way, the vessel stays in the middle of the screen. Okay, so I know that this is going to be my approach, and I'm going to be standing here for that. So that's great. Good position, good vessel. Now, I'm going to just make sure I clean up his neck, because then the next step is going to be to get some personal protective equipment and some gown and mask and hat on to keep things sterile, and then we're going to start to unpack. Okay?
Do you want to do that as well?
Yeah, everyone in the room should ideally be wearing a gown and mask, so I'm going to put on my trusty mask to make sure that I don't contaminate any of the equipment. Alright.
Do you do it before you open, or just before you do the procedure?
Yeah, I usually put my mask on first, and the hat on first, so that while I'm opening, I'm not breathing all over all the stuff.
Oh, I see that.
So that's the way I do it. So, and then I'll take my watch off usually, because when I'm scrubbing, I might have my watch off. Okay, so let's get this thing set up.
If you can just quickly talk me through what all things that you've got here.
So look, I've got an anaesthetic procedure pack.
Yeah.
Got an anaesthetic procedure pack. Now this has got a lot of the equipment inside it. Okay, it's got a sterile field. It's got galley pots where I can put my saline, my prep, and my local anaesthetic. Because this patient's awake, I'm going to be using local. Most of the time, you local is going to use local.
Oh yeah.
Good, some lidocaine, 1%, which is great. No
Yeah.
adrenaline. Great, because I don't want adrenaline because that's going to potentially be a vasoconstriction. I've got some gauze squares, and I've got a clamp to help grab those with. And I've got a couple of kidney dishes. I've got some needles and syringes in here.
Yep.
For drawing up and administering the local.
Good.
And yeah, so I've got all that stuff in there. I've got my CVC. In this case, I've got a 4-lumen CVC. Okay, 4-lumen, 5-lumen. Both of those are very useful. I know that the infection rate is thought to go up with the extra lumens, so I don't have to put a 5 and I might not, but sometimes with the really sick ones you do. But a 4-lumen is usually a good bet. Okay, and that's a complete kit. I've also got my ultrasound probe cover here for when I'm sterile. I'm going to be clothing the ultrasound as we go through. I've got my saline for flushing, my chlorhexidine for antisepsis, and I've got my lidocaine there. I've also got where is it? My gown, sorry, and both my size for when it's time to get prepped. So I think we should start to open.
Yeah, let's do it.
Thanks for that. So usually I have a bin here just to sort of put things in, but we won't do that today. So you just open that Thanks, mate. Do a bit of hand hygiene, put my gloves on. Alright. And every pack's different, so this one opens like this. Okay, there's a little tear thing, and that one goes over that side, this one goes over that
Do you
side.
need sterile gloves to touch that?
Not the outside, no.
Oh,
Once
okay.
it's open, we
Yeah.
won't be touching anything on there until we are scrubbed ourselves.
Don't it's the inside, outside you can touch.
That's right, yeah, exactly right. So what we're going to do is I'll show you on this side. This particular one has long sides, right? So you can touch down here. We're going to open it up and we can see that there are a couple of pleats. Okay, so we're going to grab this one, which goes out this way. We're going to grab this one. And Sam's going to do the same on the other side. And we're going to open it out together. Yep, so open it out like that, and we've got a sterile pack in there. Alright, now I'm going to start getting some stuff out. Sometimes my nurses will help me with this
I
stuff.
can help you with that. I can
Thanks, mate.
nurse.
Sometimes they won't, they'll be busy. Okay, I'm going to get my suture. Can I open this one?
Yeah, sure.
Cool, so we're going to open my suture onto there. I'm going to get my claw hex out. Now sometimes these will have an open pot, sometimes they'll be covered with stuff. In this case it's covered, so I'm going to get my nurse to pour that in afterwards,
Yeah.
once everything's open. And the same with the saline and the lighter.
Good stuff. Okay.
Alright, so that's all done. Blueies are very important. You must make friends with two groups of people.
Oh,
when
you're
you're
just
doing
going to
essential
move
work.
it on there, mate. Okay. Put a glue, you know.
Group 1 is the nurses. Is your score out of 10 is 10 minus the number of drops of blood on the bed. And the cleaners, same score except the drops of blood on the floor. Okay?
Happy for me to put the CVC onto your trolley and then.
Thanks, mate.
Okay.
So when I'm opening the CVC, I'll just grab the leading edge and I'll carefully open it back towards me. I usually find the best grip is to grip it kind of from the sides like that. There's a lot of parts you can grab onto like this. And I'm going to just turn it over onto there.
Do the same thing with the other.
Same thing with that. Thank you very much, Sam.
I've got a rubbish bin here for you still.
Oh, beautiful. Thanks, mate.
There you go. That's the most important thing.
Much appreciated. And then lastly, I'll get my gown and gloves set up. Usually on a separate table, although I could use that if I wanted to. I'm going to do it down.
If you want to do surgical hand hygiene
Yeah,
stuff,
no worries.
type techniques, you've got some
Beautiful. I'll open
ready
this.
for you.
Yep, I'll open this. And then
While Stu is doing it, I'm going to get you to open up the welcome pack. There will be a QR code in there, which will take you a link to Stu's website. We've got all the equipment checklist.
yeah. So if you need to give someone a list of things to get, you can just print out this list.
Yeah, hopefully, man.
Thank you. So that's all there. Now, while you're looking at that, I'm going to scrub. A good sort of 60 to 90 seconds with ideally 4% chlorhexidine or an iodine solution. Up to the elbows. Sterile surgical scrub technique. All right. Now I'm rinsing off. I'm going to come back here and Sam's going to help me put my gown on. Okay. So I'm going to use these to dry my hands. So one like that, and throw it away. And then this one is for the yellow side, and I'm going to throw it away there. And not touching anything else aside from this part of the gown. I'm going to grab my gown, slip my hands into the sides here. Hands into the sides here. I'm going to grab the inside and open it out, and then let things fall down. I'm going to put my arms out through there, again making sure not to touch anything. And I'm going to turn around so Sam can do this up. I'll show you from the back. Just going to do it with Velcro at the top. Now inside on the right, there's the other tie. Sam's going to come in. Now there are different ways of doing this, but ideally you still have your hands inside the cuffs. I'm going to kind of be grabbing through the cuffs like that. And ideally, this gown's too small for me, so that always comes undone. Extra large is better. Anyway, so I'm going to open this up, and there's a left and a right glove, so I'm going to grab the left-hand glove between my thumb and fingers here, grab the cuff, and I'm going to grab the other side of the cuff from here, reflect it over, and pull it back down. And then I'm going to pull the sleeve like that, so my fingers come through, and I have one glove. I'm going to use the second glove, again, thumb and fingers, laid on top, pulled over. So I'm going back. Right. Then ideally I'll hand this off to Sam, grab cardboard only. I'll turn around slowly so that I don't pull it out of his hands, and grab that bit. So that way we're not touching each other, and I can remain fully sterile. And tie that up. Now I'm ready to go. So hands always in front of me, because I don't want to accidentally touch something. What I'm going to do, I'm going to move the trolley, I'm going to start getting things ready. So, Sam, if you could please pretend to pour some chlorhexidine into that one. Excellent. I'm not going to use chlorhexidine because this particular mannequin doesn't like it. Alright, some saline into the other one, please. Great. Okay, so I've got my chlorhexidine and the saline there. Because the chlorhexidine on the Drape has a tendency to spill and contaminate things, I usually like to draw up my saline first. Usually with one of the two 10mm syringes in here. I can open this up. Because invariably your chlorhex will splash into your saline. Okay, so I'm drawing out my saline. That's one. I usually like to have two. This one will do. A bit. There you go. So a couple of saline syringes. I'm going to just use this as my bin here. And then I'm going to get my local anaesthetic from Sam. So I'm going to get my needle, drawing up needle, attach it to the syringe. We'll check the expiry date and the time. Sam's going to hold it upside down. And I'm going to put this up inside. And carefully and draw it up. Like that. That'll do. And then I have my local anaesthetic here, which I'm going to keep separate to my saline. Do that, Sam. Thank you very much. Alright. So actually this pack comes with a surgical gown as well, which is handy. Most of them don't. So I'm going to just start to organise my tray. Now,
I've also seen some people doing the skin preps too.
Yeah.
So the time to...
Yeah, that's right. So at this stage, it's a good time to do the skin prep. So what I like to do is get a couple of gauze squares. Yep, you shall see. A couple of gauze squares and prepare for some skin prep. So gauze square and Chlorhex, gauze square and Chlorhex, I usually do 3 passes. Okay. So I've got my Chlorhex in here, and a couple of gauze squares soaked in Chlorhex. So I'm going to do one. I'm going to start from the centre and just do a nice round spiral out around the mannequin. Okay, so that there's a good coverage. I'm going to pop that in the bin. For my second dip, again the same, and a third dip, and then the same. So I'm always working from the inside out, nice wide area, because I don't want any unprepped skin to show up. And I'm going to throw this whole receptacle, this whole kidney dish out. Alright, so now it's time to get organised. So what I'm going to do, I'm going to throw away the things that don't matter, and I'm going to get the things that I need organised from left to right. So Drape, and I'm going to need to prep my ultrasound, so I'll get my ultrasound probe there. Then when it's time to insert the central line, I'm going to need my needle and syringe, so my Cook's needle and my syringe. I like to align the bevel up with the numbers, so that once the needle's inside the skin, if I can see numbers, the bevel's up. Put that there. Once the needle's in, I'm going to be putting in the guide wire. So I like to make sure the wire is set up. Okay, this is my thumb grip, and this is the introducer. Put that next. After the wire, I'm going to dilate. So I've got my dilator. And after that, I'm going to be putting in my central line. Okay, so I line those up from left to right. Basically anything else I don't really need. Get rid of this and this. Put that stuff all up there, and I like to keep sharps in a separate container if I have one available. Alright, so I've got my local anaesthetic, which I'm also going to use once the drape's on. Okay, so that should be enough time for that to dry. So I'm going to get my drape, which is a window drape, it's a fenestrated drape. I'm going to peel these off. I think, yeah, or should I just leave them on? Yeah, so I'm going to peel these off, that's the adhesive side, okay? And then I'm going to put it long ways in line with what I want to do. Okay, that'll give you the most exposure. I like to put it kind of in a midline fashion and then fold out like a hook. And then you take one, throw it out that way, one, throw it out this way. And then you'll see a textured blue surface, that's the sterile surface. We don't want to touch the sort of plasticized surface underneath. And that one goes out that side, this one goes out this side.
A bit covered for a bit.
Sorry, buddy. Alright, just give us a little wave of your hand if you need any help, and please don't touch the blue surface. Okay, now I've set up my sterile field here, I can start to bring things in and start to get closer to actually putting the line in. So I'm going to bring my trolley over here. Now, dominant hand is the side you want your trolley on. Okay? So left hand, non-dominant hand holds the probe, dominant hand has the trolley next to it and has all the equipment. So I'm going to close my ultrasound probe now. Actually, usually before I close the probe, I usually like to put on the local anaesthetic. So now we'll close the probe first because we need to know exactly where we're going to put it. So I have my ultrasound probe equipment. I've got the probe cover itself, 2 elastic bands, and the ultrasound gel. So I'm going to give the ultrasound gel a flick, take the top off, and pop it in here. What I like to do is just stick it all the way in, right, till I can see that it's right down the bottom, and squeeze from the outside so that I get half of it in. I just pull it out. Need to have some for the outside. And then I'll just keep that open, and this is the tricky part, right? So we're going to insert the probe into there without me touching the probe, and without the probe touching any of the sterile bit. So I'm going to do this slowly. So Sam, if you could just gently lower the probe in there. Okay? That's good. So I'm still holding the outside. And I need that probe to be down in that bottom section, okay? Because I'm going to grab it, and then Sam's going to take that cardboard section and pull. Gently, gently. If it's pulled too fast, sometimes you drop the probe, and then you've got to start again, okay? So now we've extended the probe cover all the way over. We have a nice, sterile outer covering to the probe. I'm going to get one of my elastic bands, and I'm going to put it in sometime, once around or twice around, something like that. Some people put another one up here. Don't worry about it. Doesn't usually help me too much. So now I've got the probe with the gel on the inside. I need some gel on the outside. I'm going to put some on the patient.
So I've seen some people clamping.
Oh yeah, so that's something that you can do as well. Now this pack doesn't have a clamp in it, but often if there's a plastic clamp or something, you can pinch a bit of the drape like that, and the plastic, and put a clamp on there to stop this drape from pulling too much. Don't clamp the actual ultrasound cable, because that can cause damage. But yeah, we would often clamp it as well. So I'm going to now use my ultrasound, we don't have a clamp in there. I'm going to now use the ultrasound to have a look at the vein, at the vessel. So that's great. So I can see a good picture of the vein there. Now I'm going to use my local anaesthetic. I'm going to make sure that vessel's in the middle, and I'm moving along the vessel. See, I'm going to use my local anaesthetic. I'm going to put it about 2 centimetres towards me from the midline of the probe. So you can see me kind of jiggling the soft tissue there. Do you mind if I actually put needle in? Or not this one?
Not local, but get
Oh, needle, just so you can see. Right. So, local anaesthetic, I'm going to just put it in there, and when I'm holding the probe, by the way, I'm using my little finger to stabilise on the skin. All right, it's really helpful to prevent the probe just drifting or me putting too much pressure on it because I'm leaning on it. All right, so I'm just stabilising. I'm going to put the local anaesthetic in here, and I usually put a bleb under the skin and go deep enough so that I can see the needle come into view in the ultrasound, and put it and instill local anaesthetic as I withdraw from that point. I don't want the local anaesthetic needle to go further than that, but that's how I'm doing it. And then I put my needle in the sharps container, which is usually a yellow kitty dish. Right, so I've got my local anaesthetic there. I can get everything ready to put in. So I have my needle. I'm going to loosen the cover on it. I have my wire. I have my dilator and my central line. Now, while I'm waiting for the local anaesthetic to take maximal effect, I'm going to prime my central line. Okay, I'm going to do this with saline, and with each of these lumens, once I prime it, so I'm going to take the top off for this thing that comes with it. I'm going to prime it with saline, and for me, I clamp this lumen once I've primed it. Okay, it stops the water from coming out. I'm going to do the same with each lumen. Okay, take it off.
So why do you prime it?
So I prime it because there's a couple of reasons. Number one, an air embolism is very potentially harmful or potentially fatal if you accidentally flush it and it's not primed once you put it in. Second reason is because if you don't prime it, when you let it aspirate to check if the lumen is intravascular, what will happen is the blood will really stick to the tubing, and it kind of looks a bit dodgy. We all know blood is bug food, and pretty central line is a good central line. So prime and lock. Prime and lock. Okay. Now with the brown one, I prime it, but we're not going to lock it because this is the one that my wire is going to go through. So I'm just going to leave my central line down here. And now that these bungs have been removed, I can discard them, these ones, and I'm going to put one of the proper PosiFlow bungs on the end. So I'm ready, so the locals have time to take effect. I'm going to bring my needle and my wire, and I'm going to get ready to put in the central line. So I usually bring my wire over to be on the patient. Okay, so I'm going to use the out of plane technique. My bevel is up, aligned with my numbers. A final scan up and down the vessel, and I'm going to insert the needle about a centimetre or two closer to myself in the midline. And I'm just going to go at about a 30-ish degree angle until I see it. 30-ish degree angle until I see it. I can see it starting to tent. See, I go back and forth to make sure I can't see it. I can see it starting to tent the top of it, and so I'm going to move my probe slightly away, and I'm going to enter the vessel. There, move my probe away. There, I can feel it give there. Move my probe away, and I'm going to flatten out and go a little bit further. So I can move it side to side, so I can see that it's clearly not dragging on any soft tissue. And also I can aspirate, and I'm aspirating venous blood there. Yep. So that's good. So now what I'm going to do is I'm going to put the guide wire in. Now I'm wary of people being able to breathe in and entrain air, so I'm going to time my exchanges with the breath out, and I'm also going to put my thumb. I'm going to be holding my needle with my middle finger and thumb. I'm going to put my index finger over the tip when I take the syringe off. Okay? So he's breathing in, he's breathing out, and I've just exchanged it there, so my finger is over top, so there's no risk of air getting entrained with the next breath in. And then on the next breath out, I'm going to insert my guide wire, which is in the introducer there. So, it breathes in and breathes out, and I'm inserting my wire. And what I should feel is unobstructed passage, and I should feel and I should see it go fairly easily. Okay? Now once it's into about 20 centimetres, I can tell that because there's a couple of markings on the wire. A bit further, I'm going to be keeping an eye on the monitor. Ding, 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 ding,
oh,
ding.
VT. Oh yeah,
there's a line on the monitor there. A little bit. Right, so I'm watching for irritation of the myocardium, which you'll see by ectopics, sometimes VT. Right, so I've got the wire in. I'm just going to double check with the ultrasound so I can see the needle and wire coming along down there nicely. It keeps going along in there. And I'm going to switch to long axis and just show what that looks like in long axis. So I can see that wire going nicely all the way down there. Okay. Now,
I've seen people looking at the artery this time to make sure it hasn't gone through and through
Yes, that's
into
true.
the artery as well.
So you can also have a close look at the artery, and if you're in long axis, you can see that's the vein, and you can also see the deeper artery, which is usually pulsatile, not showing any signs of a needle or wire in it.
Confirms to have looked at the artery, there's no iron there.
That's right.
Happy for it to dilate.
And so now I'm going to pull out my needle, keeping my wire still in space and drawing my needle towards myself. So the wire doesn't move out, okay? Needle goes down the shafts. And now I'm going to make a nick in the skin at the same location as the wire and then dilate. I might use a different model for that. So I'm just going to switch over quickly. It's just under the, it's just next to the right shoulder, I guess. Yeah, yeah, perfect.
All right, all of a sudden.
So I'm just going to, sorry about the fidelity folks, so I'm just going to needle. So I'm just going to put the wire in this one.
If you're in, you should come to the other end.
I'm going to cheat. There we go. It's not often you can actually look down into it. Alright, I'm just going to pop this wire through. Come on, here you can see. It's a good example of what a flat looks like.
There you go.
As you insert. Alright, now I've confirmed my wire's in position, taken my needle off and put it in a safe place. Now I'm going to make a nick on the skin with my scalpel that I have, so just in there, and then I'm going to move my wire around to make sure it's within the nick and not, and there's not a skin bridge between the wire and the nick. You get my dilator. And here sometimes it's helpful to have a little bit of gauze around that you can kind of put on the skin. And I usually like to give a little curl, and these are really hard to thread in the middle of the air, like this. So what I do is I lay it against my hand, and I insert it like that. So just bracing on your own hand, like that. Yeah. Oh, that should be right. And then once I've made a cut, once I've made a cut, I'm going to be holding the wire, okay, with one hand, and then I usually use a few fingers along the dilator, like that, and I just have gentle pressure, and sometimes when it's really slippery, a little bit of gauze or something like that is helpful to be able to grip it, and you can push it gently. You're going to move the wire in and out as you go. If you just push the dilator and the wire in together, you're going to kink the wire, and kinked wire makes everything harder after that. So I'm inserting, jiggling, inserting, jiggling. I think we might have a technical issue. A fidelity related issue. Once that's gone, once you've felt a loss of resistance and gone in, okay, take the dilator out again, making sure the wire doesn't come with it. And I usually keep a bit of pressure on that while it's going, because this is the time when it's going to lose up the hose. Then I'm going to put my central line. Again, I'm going to go right down to the tip, make it small movements. I'm just going to insert the wire into the tip, and then keep inserting it until I see it come out brown lumen. So I'm watching this lumen here, which I haven't clamped. Okay. Bring it out, bring it out, bring it out. And here it comes. So I can see it outside the brown lumen now. Okay. I'm going to transfer my grip. I'm going to hold the wire in space. I'm going to steadily advance the central line all the way into the vessel until it's at, on the right side, about 15 centimetres is appropriate, 15 to 16. You know, so that on the left it might be higher, 17, 18. Okay.
And how do you confirm that you're in?
Yeah, so at this point what I usually do is I ultrasound it again. Okay. So once it's in, the wire has come out. Again, timing it for a breath out and with my thumb ready to put over the hole. The wire's come out. Now to clamp this, we're going to put one of our copper bungs on there, but for the sake of argument, we'll just put one of the ones that came with it on a breath out. And then what I'll be doing is I'll test, aspirate and flush each of the lumens to make sure they're in the right place. So aspirating blood is a sign you're in a vessel. Okay? They're going to flush easily is also a sign you're probably in a vessel. And then I'm going to ultrasound to see that it's clearly still in the jugular and not in the crural. Okay? Once I've done that, I'm going to secure it down, which, do you want to demonstrate that? No. All right, which we'll talk about in a later workshop, but it's going to be with Roman sandal style suture. Okay? And then sterile dressing. And what's the last point? Got to document. Okay?